Next is your Echinococcus granulosus. So a brief history is your Echinococcus granulosus is your dog tapeworm or hydatid tapeworm. So your hydatid cyst has been described by Hippocrates. The adult Echinococcus granulosus was first described by Hartmann in the small intestine of the dog, and the larval form recognized by Goes in 1782, and they are seen more often in the tropical regions. The adult worms lives in the jejunum and duodenum of Canis lupus familiaris or dogs and other canine carnivore. And the larval stage, no, this is what's different to the Echinococcus granulus, is the hydatid cyst. It's found in us, Homo sapiens, and herbivorous animals. So the adult worm, no, they measure only 3 to 6 millimeters, and they consist of a scolex, a short neck, and a strobila. The scolex is pyriform with 4 suckers and a prominent rostellum bearing 2 circulatory rows of hooklets and a 3 millimeter neck, and they live 6 to 30 months. The egg is indistinguishable from Tina species. They're ovoid in shape and color, and they contain embryo with 3 pairs of hooklets. The larval form is found within a hydatid cyst. So that's your hydatid cyst. No? And it presents the structure of the scolex of adult worm and remains invaginated within a vesicular body. So after entering the definitive vost, the scolex with suckers and rostellar hooklets becomes exvaginated and they develop into an adult worm. So, ayan. So, for your life cycle, no, the adult granulosus, they reside in the small intestine of your definitive host. Then the gravid proglotids release the eggs and pass in the feces. They are the one who remains infectious. So after ingestion by a suitable intermediate host, no, that eggs hatch in the small intestine and they release a sixth hooked oncosphere that penetrate the intestinal wall, and then they migrate to the circulatory system into various organs, especially your liver and your lungs. So in these organs, the oncosphere, they develop into thick-walled hydatid cyst that enlarges gradually, producing protoscolices and daughter cysts that fill the cyst interiorly. And the definitive host becomes infected by ingesting the cyst-containing organs of the infected intermediate host. So after ingestion, the protoscolices invaginate, then they attach to the intestinal mucosa, and they develop into untold stages, around 32 to 80 days. So humans, as we are intermediate hosts and become infected by ingesting the eggs. Then oncospheres are same. The oncospheres will be released in our intestine, and the hydatid cyst develop in our variety of our organs. And if this cyst rupture, their liberated protoscolices, they may create secondary cysts in other sites within our body. That's your secondary echinocosis. So, human cystic echinocosis is caused by developing larval cyst that becomes hydatid cyst. Your cysts have 3 layers: your pericyst, your ectocyst, and your endocyst, which is inner. They are filled with clear, colorless, pale yellow fluid called a hydatid fluid, which has a pH of 6.7. So that's your hydatid cyst. So clinical features, they are asymptomatic, and if they're big, grown enough, they cause obstructive symptoms. And they occur in the liver, especially in the right lobe, and they cause obstructive jaundice. Then in the lungs, what's more affected is the lower lobe in the right lung. So that will cause your cough, hemoptysis, chest pain, pneumothorax, and dyspnea. So they can also be seen in your kidney. That will cause pain and hematuria. And other sides include the spleen, the brain, pelvic organs, and orbit and bones. So to diagnose this, we use ultrasound, which is the procedure of choice. Um, that's USG ultrasonography. Then CT scan, no, this is helpful for external hepatic manifestation. Then we use MRI, no, for the cyst in spinal and cardiac locations. And for X-ray, we use this for the cyst in bones and lungs, and IV pyelogram if it's a renal cyst. We treat this, no, we traditionally surgical removal is the best mode of treatment, but currently ultrasound is recommended. So medications is mebendazole, albendazole, and praziquantel. Early stages of the treatment of choice is puncture, aspiration, injection, and reaspiration. So thank you very much. That is it for your Echinococcus granulosus.